email? Great, thanks, Kim. Kim, yeah, if you could help with mute, I'll ask to unmute. Okay. So as you would have seen from the emails, and as you may have heard, member states of the of the World Health Organization have agreed to a global process to draft and negotiate a convention, what will be a convention, treaty, or agreement to strengthen pandemic prevention, preparedness, and response. So really for the next hour or so, we're looking to have an informal dialogue on this and what it means for people who use drugs. But first, we also, of course, wanted to update everyone on the progress of draft.
Judy, you are mute.
Oh, okay.
We can't hear you.
Okay, sorry about that. Yes, okay, yeah, others could mute, that would be great. So start again. Welcome everyone to this webinar on global health and pandemic preparedness. So as you would have seen from emails, also heard, member states of the World Health Organization have agreed to a global process to draft and negotiate what will be either a convention, treaty, or agreement to strengthen pandemic prevention, preparedness, and responses. So really for the next hour or so, we wanted to look at having an informal dialogue and seek inputs from you all, but we also wanted to update everyone on the progress of the draft and negotiation process, or of what we know so far of the pandemic agreement. So we think it will be important for drug user-led networks, around the world to engage, because we saw what happened, in the early days of COVID and its impact on people who use drugs and harm reduction. And we also, of course, know how hard we all had to work, to support communities during this time. Because as always, we're always made to be last in line when it comes to any support. So therefore, any global agreement that's negotiated by member states should really reflect what we learned from COVID. Just a quick update, INPUD did attend the high-level meeting on PPPR, and this happened in September last year in New York. And basically, I would say the general observations that us and other civil society partners had made as well is that there was very limited engagement opportunities for civil society, especially, those in the HIV sector like we are. And this limited engagement, really came out during the negotiation process, but also, during the main panels as well. Secondly, there wasn't much engagement from heads of state. The negotiations, were heavily shaped or contaminated against geopolitical fault lines. So as always, it was a very politically contested process. And all of this, really kind of came together to mean that there was a very weak political declaration on PPPR in the end. And it was mainly focused on medical countermeasures, and primarily, didn't really touch on the issues or reflect the issues that we really care about. So in the final political declaration, despite civil society advocacy, the language of community leadership was removed. There was no specific commitment to fund civil society and communities. There was no mention at all of populations affected by criminalization and marginalization. And there was only, this very broad language on vulnerabilities as related to people living with comorbidities, chronic conditions, and persons with disabilities. So with all this in mind, we really want to use this opportunity of being together to capture emerging issues and advocacy priorities from you all, and also to understand what you think INPUD's priority agenda should be in the drafting and negotiation process. And at the end, to do some thinking and strategizing about how we engage member state delegations at the country level in the lead up to May 2024. So next I'll turn to Rico, and he'll take us through, the specific agenda, and also go through an overview of the terms, mechanisms, and processes.
Thanks, Judy. And apologies for my voice. I'm having a bit of a problem with my voice. It might get heavier as I speak. I'm sorry for that. So, we have a lineup of speakers for today. Courtney Ho is from Stop AIDS UK. And after her, sorry. In the flyer is still Anton Basenko, but actually, Ernesto Cortes is going to replace him to speak from the perspective of the INPUD board member, and also to represent the issue, to present the issues that has been identified related to the pandemic preparedness. And then after that, Robin Montgomery will try to summarize some of the message that we will discuss in this webinar. And I think so this is the agenda that we have for today. We'll first discuss about just to familiarize ourselves ourselves with terms that usually used in the United Nations, what are convention, treaty, or agreement, or stuff like that. And after that, we're going to go a little bit deeper into the pandemic preparedness agreement itself. And then hopefully we're going to have an interactive discussion with all of you. And we're inviting you to already contribute through the chat function as we speak, so we can already capture your voices. And then after that, we're going to summarize the discussions, and Robin will do that. And let me start with that first question that we usually have. What are the difference between convention, treaty, or agreement? Well, basically, convention, treaty, agreements are basically all examples of international instruments. And this is quite important because these instruments are usually legally binding, and it's made between countries. And we've seen other agreements, and it's can be quite a broad range of topics: tobacco control, nuclear, chemicals, biological weapons, and blah blah. So those are what the UN meant with convention, treaty, or agreement. And the second, sorry, I cannot see my own screen. Is it showing, Judy?
Yes, it's showing. So if we could just, on what could happen if countries that join or participate in any new accord do not meet their obligations.
Yes. So this is also one of the things that ask often about treaty or agreement, because, for example, the political declaration on HIV that sort of took place in, I think, around 2001 or 2002. What happened if the country signed the agreement and they do not meet their obligation? Now, this is up to the member states to decide what's the compliance mechanism, what's the sanction, and what should be the response of the United Nations on events where some countries does not meet their obligation as they agreed in the treaties. So it is possible, because some people, there's this belief that, well, not belief, there's this opinions that all UN agreements or all UN treaties are not legally binding. That's not necessarily true. It is really up to the member states to put the, how far, what's the extent of the legal consequences, and what's the mechanism to be put in that agreement itself. And this is the timeline that we have. Well, for 2024, the process has been going on since 2001, actually. But for 2024, there will be like 3 more INB meetings leading up to May, and the process will sort of peak at the World Health Assembly, where they will officially agree on well, that's the plan, officially agree on the treaty. And that's May 2024. Yeah. And I think now I'm going to invite Courtney.
Thanks, Rico. Is it possible for me to share my screen?
Yes,
I'm
actually.
stop somebody else's. Sorry if I click continue. Oh. Great. Hopefully everyone can see that.
Yeah, we can see it.
Great. Thank you. And yeah, hi, everyone. I'm Courtney. Judy mentioned I'm based at StopAIDS in the UK, where I lead the Inclusive Global Health Institutions project, looking at global health governance and civil society participation. It's a project hosted by Wacky Health, Global Fund Advocates Network, and StopAIDS. And I'm just going to give a brief kind of update on the kind of pandemic preparedness landscape, and then a little bit around some of the kind of key pieces that are coming up within the pandemic accord. So as you can imagine, obviously following COVID-19, there has been a lot more focus on pandemic prevention, preparedness, and response. This very small diagram is just like one part of everything that has been discussed, and it's very much focused on global processes. There's so much more that is happening within that broader landscape, but just wanted to highlight a couple of them because I think they link with our discussion around like the pandemic accord, which we'll discuss more. Because there is the pandemic fund, which has been established at the World Bank. Its aim is to sort of finance strengthening pandemic prevention preparedness capacities at a national, regional level with a focus on low middle income countries. And there's lots of discussions about financing the accord and the links possibly between that and the pandemic fund. There's also the high level meeting, which I'm not going to go into because I completely agree with everything that Judy raised around the meeting that took place last year. And again, in the member state engagement there, we kept hearing that part of the reason for the kind of lack of what some see obviously as the ambition and the targets in that political declaration that was agreed is because member states are waiting for the pandemic accord, and they see that as the kind of place to discuss that and to agree, which again, I think just highlights how critical the WHO process is. And then finally, there's the IMCM net, which is a process led by the World Health Organization that's looking at medical countermeasures. So again, trying to learn from COVID-19, how do we ensure equitable access to medical countermeasures for future pandemics? And again, the team at WHO, the global health institutions that are working on that, are sort of in the process of developing a report this year that will then be shared with member states to then look at what needs to be done in the follow-up to the pandemic accord. So I do think the kind of accord is one of the kind of main pieces of this kind of global landscape. And it is significant, you know, that this is only the second time ever that the World Health Organization's negotiated a legally binding instrument after the tobacco control. I won't go through the timeframe because Rico's just covered this. I think when you look at the time frame and we think about starting in 2022 and you see how many meetings have already happened, you maybe assume that a lot of progress has been made and that we're getting towards the end of the process. But I actually think this is a really critical moment now. I think, you know, only in the last couple of months have we had a proposed negotiating text for the member states to start to actually negotiate on. You know, there's been previous versions. So even though there's kind of these couple of meetings left, they're described, I think in the time frame as like 2-week marathons. So there is these really key moments now where we're expecting a lot of the negotiation to actually happen, even though it looks like it's right at the end of the timeline. And so that proposed negotiation text, there's been many different versions. There's been working drafts, there's been 0 drafts. And in October, the Bureau of the Intergovernmental Negotiating Body, which is just 6 member states from each region, kind of trying to coordinate the process with the WHO Secretariat, pulled together this proposal for what should be the basis to start negotiations. Now, that in itself is still under discussion. I think some member states do still feel that a lot of things that were in previous working drafts or 0 drafts have been removed without further discussion. But this is sort of what the current proposal looks at. There's a kind of opening chapter which sets out some general principles to guide the accord. It then gets into chapter 2, which is where the obligations on member states are. And then the third chapter kind of covers the obligations around like governance, which I'll speak a little bit around at the end. I won't go into all of these, but did just want to highlight a couple of the kind of key areas I think that are like largely challenges, I think, in terms of where we look at negotiations. There's also a lot to say on access to medicines, research and development, production, and I'm happy to share links to sort of colleagues who work on those areas around their reports that they cover on that. But I just wanted to highlight these kind of 4 pieces. I think firstly on human rights, there was a 0 draft developed, I think, sort of early 2023. And whilst it certainly needed a lot of improvement in terms of human rights mentions and obligations, they were there. And I think since then, we've seen the human rights language diminish in the drafts that have come forward since. So as I said, the opening chapter starts with general principles that should guide this whole document. And there used to be a kind of more in detailed respect for human rights principle. It's still there, but it previously sort of talked about, that each party, each member state should protect and promote sort of like the freedoms of the full respect of dignity, human rights, and fundamental freedoms. The kind of recognition of human rights is there, but the obligation on states to sort of protect and promote those has been removed. And also later in the document, there previously was an Article 14, which is all around protecting human rights. So it's about non-discriminatory measures, emphasizing particularly the rights of people in vulnerable situations, the need for human rights protections during public emergencies, making sure that they're aligned with international law, making sure that they're non-discriminatory, necessary to achieve the public health goal, ensuring people who are living under any restrictions of movement, such as quarantines, still have sufficient access to medication. And so there was a significant sort of protection of human rights article, which can still be accessed, or the 0 draft is still available, but that has been completely removed. And instead, we see this sort of one line in the international cooperation section, which just talks now about respect, protect, and fulfill the human rights of all people. So overall, and colleagues in different spaces have really shared that in terms of human rights, the text doesn't really reflect the daily reality for so many people during COVID-19, and the language has certainly been rolled back, particularly on human rights. And I think that's a key focus for a different group of networks that are trying to engage in the process over the next couple of months. Financing, one of the big questions that comes up a lot is how are we going to fund all of these obligations? How are member states going to make sure that they are better prepared and are obliging with the obligations in the accord? But where is the financing going to come from? This is still a very open question, even at this stage. A couple of months ago, the World Health Organization held an informal meeting with member states, and they brought in different funding mechanisms to hear from how they work. So they brought in the pandemic fund that I mentioned earlier. They also looked to some funds working on climate as well to say, okay, how do we do this? How do we bring in the funding? How is it sustainable? And the overall aim is to have a sustainable financing mechanism, but actually the current text talks about that not being established. Well, it says no later than December 2026. Again, I think people are pushing that unless there is the funding there, this is going to be very difficult to implement effectively. So again, trying to push member states to make sure that this is addressed within these next couple of months. And then civil society and community participation. I would say across the pandemic preparedness landscape, this is just such a challenge that we're still having to make the case for civil society community participation. As Judy mentioned, we saw that with the high-level meeting. There was no civil society engagement mechanism similar to universal health coverage or TB. And it's very limited participation throughout these negotiations. So if your organization wants to participate, you either need to be in official relation with WHO, which is a significant accreditation process, which is a quite a long process. So it would already need to be in place. Or you need to be identified as a relevant stakeholder. But in order to be identified as a relevant stakeholder, you need a member state to put your organization's name forward. And then that group, that list of organizations are then approved within the intergovernmental negotiating body of all the member states. So the process to actually get approval is difficult. And then when you are either in official relation or relevant stakeholder, participation has still been very, very low. So generally, it means organizations can attend the opening segment and the closing segment, but you don't actually get to be in the room or to follow the negotiations. Member states are doing that all just amongst themselves without any civil society communities able to not even, input, but also to hear what's happening. The participation is limited to a 2-minute statement, which, given everything that's in this accord, is very challenging to try to raise in 2 minutes. And October was the first time, October 2023 was the first time that stakeholders could attend in person. Again, it was still the opening and the closing session. It was very short notice. It doesn't, they haven't addressed the fact that there's the opening of participation, but there's also supporting participation. It's very expensive to be traveling to Geneva for a 2-minute statement, and the short notice makes it very difficult for visas as well, which limits participation there as well. And then finally, just around the conference of parties, and I think this actually ties to what Rico was saying around some of the language that we use around what is this going to be in terms of when we talk about a pandemic accord. So the expectation still is that by the time we get to May of this year, that we'll have member states who have agreed what this pandemic accord includes. And then it requires, I think, 40 member states to accept it, approve it, bring it into their own systems for it to come in place. And then it will be legally binding on those member states. They are looking at a conference of parties that's included in there. And that would basically be the place, similar in other climate. I think we talk about the COPs more there, but that will be where the parties, so the member states, come together and discuss progress. And that's where member states will also be required to report on how they're doing in terms of implementing their obligations. And I think, again, it's a really linked to when we were talking about accountability mechanisms and what happens if they don't meet their obligations. It really highlights why we need civil society participation, not only in the drafting, negotiating now, but also in the conference of parties and in any kind of mechanism that does have that kind of oversight. And then finally, the other thing I just wanted to highlight in terms of the type of agreement, Rico's slide mentioned a framework convention. And again, this is a very live discussion that member states are having now. The other legal instrument, the World Health Organization, the tobacco control, is a framework convention. If that is the route that they go, then we'd expect in May to have an agreement or an accord that's quite a little bit more general in terms of its obligations. And then what would happen is that the more detailed, more specific parts would be agreed, negotiated by member states in subsequent protocols. So as I said, it's still not decided, it's still being discussed. But again, if that is the route they go, and it's same again with tobacco control, that does mean that there will be these negotiations and these discussions and the need to engage member states beyond the kind of May final document. And again, it really highlights, because that will take place at the conference of parties, why that is going to be a crucial space going forwards. So I think, looking longer term at the role of civil society in the conference of parties, the kind of oversight mechanisms, as well as recognizing that right now is a really critical moment as they go into their key negotiation times. I'm really interested to discuss with colleagues how we engage with member states over the next few weeks and how we can collaborate across civil society and make use of the very limited space some organizations, networks have within the negotiation space to highlight broader concerns across our networks as well. So I'll stop there. Thanks so much.
Thanks so much, Courtney. And thanks so much for We'll Stop AIDS and your leadership as well in this whole very complex terrain. So just before I move over into Q&A, because I'm sure there's lots of questions and inputs, just a final call for people to rename themselves. If you just go to the top right of your screen, you'll see the top 3 dots, and you can click on it and then rename. So I can just imagine it being very messy and trying to understand who's got their hand up. And I can already see it being a mess in the chat. I didn't write all those. So I'll just give people a few seconds for that. So I already see some comments around the importance of addressing issues of criminalization as well. So maybe we can come back to that in the end in a discussion about strategies on how we can push certain pieces. So just if people have a question, if you put your hand up, and then I'll be able to call on you. Ahmed?
Yes, yeah, thank you so much, Judy, and Happy New Year to everyone. I believe the calendar has also changed in other spheres. You know, sometimes time changes from other spheres and time, yeah, and maybe I really love the presentation and even the summary of it in terms of human rights and all that, and even the civil society involvement. And there is one thing that you've mentioned in your presentation regarding to, I think it was mentioning something to do with how we also respond to the climate changing, because now the climate change has become a very huge subject across the globe. And now we are talking about the preparedness of the pandemic. And we are looking at it, how the pandemic affect us, especially for us coming from the low and middle income countries, because we had a lot of people being raided for mob justice because of the lockdowns. We had some people up to date, they are still ailing injuries that came because of the mob injustice and all that. And we also had programs that were closed because of the pandemic. And I'm happy as we are coming up with this treaty, as we are coming up with the convention, maybe what are the clear roles of the community of people who use drugs, particularly in Africa, where we've seen most of the harm reduction program in relation to climate change. People are opposing harm reduction program because of poor disposal that has been there. Maybe what's your take in that? And secondly, our facilities still, they don't have that proper sanitation. Even the time of COVID, people were told not to visit a certain facility. So I don't know how that will align with the realities that we have here in Africa and even in other third world area that people who use drugs are there. Lastly, I think it's about the policy design. How will also this policy be simplified? Like the way you did, I really love, you spoke so many stuff, so many content, but in summary, in few lines, in few bulletin. How do we also ensure that in that convention, when now we disseminate to the community also, it will be easier as you've done it? I think those are my few questions on that. Yeah, thank you, and over. Yeah.
Okay, I might just take a first round of hands and then come back, Courtney, if that's okay. And then also, yeah, Rika and Robin also have responses as well. So next, yeah, I had Alexander. Yes, it'd be great if you can also mention which country you're from as well, and if you're affiliated with the network.
Thank you so much, Judy, for giving me this opportunity. Sorry, I'm traveling to a direct policy review meeting. I'm from Malawi. I'm the founder and the director of a network of people who use drugs called Center for Key Populations Rights. And I just wanted to concur with what Ahmed has said about climate change and human rights for people who use drugs and decriminalization. So I just wanted to share with you some experiences that Malawi is having. Last time, when we had the pandemic, people didn't access, for example, vaccinations because of the means surrounding it, and because of climate change as well. Second, 3D, people were not able to access services. As you might be aware that in Malawi, we don't even have harm reduction services, and the policy has got some harsh segments which needs to be revisited. So there is a strong need of working together and supporting this development of these protocols in order to make sure that access to services is being strengthened and there's no any violences. As you might know now that Malawi, we have got a lot of legal instruments which penalizes using drugs, and access to services becomes a problem. So I'm looking forward to hear from you on how best we can work together in supporting this accord. Thank you so much.
Thanks, Alexander. And Adam?
Thank you very much, Judy, and good afternoon to everyone here from Nigeria. I'm sorry I had to join late because I was in the field trying to coordinate work in some region. So I had to run down to attend the meeting. So for me, I want to speak from my experience during the pandemic the last time. And there are some few things I want us to take into consideration when the treaty is being drawn. If actually we are supposed to achieve a positive result from the treaty, then the decriminalization and some harsh policies in some countries that affect drug users need to be changed. You cannot say you want to achieve something when the law enforcement is pursuing me into the bush. How do I come out to access these services? How do I even have to tell somebody that I have a problem? Or what would stop me from sharing the pandemic I'm having or transferring or making other people contact it because I just want to hide it due to the fact that the policy and the laws in my country do not allow me to go out physically and access services. We also want to talk about discrimination and stigma. This actually happens to me when I was about traveling out. So it was a requirement that I had to come with my COVID-19 certificate. So the first thing that happened when the doctor realized that I was a drug user, it was, how? You use drugs? I was kept out for over 1 hour while others were being attended to. So because of the necessity of my traveling, I had to wait and attend that and access that services in able to get my certificate and travel. And I equally get to find out that before I could even move from my town to Lagos where I need to travel, my certificate has expired, which I got from the pandemic. It was one thing that stopped me from going to Tanzania. When I was about traveling, all the money I wasted, pay hotel and went to the airport, I had to pack my load back because the duration given to me on the test was just 1 week and it was not enough time for me to use it and travel. Then another thing I want to look at it is that the cost of accessing services. Can the community members actually access these services with the price fixed on it? It's not possible. These are vulnerable populations who do not have work. Some have not been to school. They do not have shelter. They do not have a place. And you now come up with a law for you to be checked or screened on a pandemic, you need to pay so and so amount. You need to go back there like 3 to 4 times for you to access these services. This already sent all the community members on the background without any of them being able to access that services. So lastly, what I want to talk about too, that we need to take into consideration too, is the location of these services. Take for instance, in the whole of Cross River State or in Calabar here as a whole, in the whole Calabar South, there was no place for anybody to walk in and access services. Everybody will bump into one local government, which is taking care of about 5 to 6 local government. How do we achieve anything positive from there? So these are the things that the treaty need to address for the benefit of people that use drugs. Over, and thank you very much.
Thanks, Adam. I was just so needy. Just before I turn to you, I just want to see if there are specific responses from Courtney, Robin, I don't know, or Rico. So yeah, some of the things I heard, and maybe I missed some of them, but yeah, had there been much discussions about the impact of climate change at all within, treaty negotiations so far? What are are there pieces around the, full affordability of services, location, things like that? And I guess the second, theme of the questions as well is around, how do we engage? You mentioned before, Courtney, of course, about, the limitations of resourcing on traveling to Geneva, but I guess also Ahmed's question around, country advocates, how would people start engaging with their governments on this?
Thanks, Judy. Yeah, I can come in. On climate, I was actually just looking back over through the proposed negotiation text, and there's sort of one mention of climate within the context of One Health. It's not something I'm as familiar with, but again, can share some resources from colleagues. And it is looking at the kind of intersections between human, animal health, but also environmental as well. And I think those are the spaces where climate is coming up. My personal view is that it's maybe not being addressed as much as it needs to. And I think it is a case of looking at where the text is now. And, it's kind of mentioned, there's a section at the start that's like use of terms. And so it describes One Health and it includes climate there. But I do think it's important to make those connections within the obligations to make sure that climate is, when countries are coming up with their national pandemic preparedness plans, how is climate being addressed there? I think that's going to be a really key area. In terms of access to services, so there are some obligations in the current text that talks around needing to maintain essential health services as well. I think, again, it's monitoring the text that then is negotiated, what kind of countries add into there, what do they try to remove at the upcoming negotiations, and advocating strongly for that to be kind of a core piece of the text, making sure that stays. And again, when we talk about obligations of states, then obviously advocating for governments to sign up to the pandemic accord, and then having that legally binding document to say this is what your obligation is, and I think pushing for that to be sort of reported on as well. I think the cost of services as well, I'd need to check around how that's addressed in there. That's also something when I mentioned, and it's not a great abbreviation, but the IMCMNet, which is the WHO-led process to look at how do we ensure equitable access to medical countermeasures. I think that's something that really needs to be addressed there. And appreciate it's a slightly separate process, but there is a connection because that report will go to member states. And I can connect offline, Judy, maybe with some information about how to input into those discussions as well. And then engaging in the process, I think at a national level, I can only speak, obviously, we're a UK-based organisation. The UK government has hosted some consultations with civil society. I think from our side, we'd like to see more being done in terms of hearing from civil society, from broader groups. We've recently reached out to them to try and encourage there to be either regional or joint member state briefings for civil society to come together. You know, there's different groupings, there's like an equity group of member states. So I think, you know, I think continuing that push for member states to consult with national, local, civil society, community organizations, to make sure that when they do go to the negotiations, that they're informed by what the priorities are of civil society and communities, and they hear those. And I think on our side, from a civil society perspective, I think those of us, and just to say StopAIDS is a relevant stakeholder, so we do have some access into the process. I think we also need to look at how we all collaborate as well, and recognizing that those organizations that have the access to the process, how can we amplify those messages from our regional, national, local community partners as well. I'll stop there. Thanks.
Okay. So I've got Anidi, John, and then Andy.
Thank you very much. Thank you, Judy, for the opportunity, and thank you very much for that presentation. It's nice. I've been trying to follow up on the discussions on pandemic preparedness, but it's been a little bit too complicated, if I must say, because there are certain questions which would pop up. I know the whole issue around pandemic preparedness, you know, also has as a central theme country ownership, and so most of the institutions that are working on the pandemic preparedness or that are really championing it in country are mostly government institutions. Like in Nigeria, we have the National Center for Disease Control that is working on it. And looking at the fact that Nigeria is criminalizes drug use, we understand that by extension, NCDC does not recognize this special population of people. And so it is not recognized that they have a higher risk, you know, than maybe the general population as a whole. So the question one would want to ask would be, would we have access to the services? I know there was a C19 RM that was proposed and funded, but I can tell you that in Nigeria, it did not sit down to the community. It was done at wherever it was done. And mainly it was around, you know, health centers. And we understand that public health institutions do not recognize people who use drugs as a special population and do not provide harm reduction services for them. And the services are not tailored to meet the specific needs of people who use drugs. So if in case there's another pandemic and we have to face the same problem and we are still running a criminalized system, how do we get access to harm reduction services? Because this was majorly disrupted during the last pandemic. And so many other questions that goes with the whole pandemic thing, including social welfare for people who use drugs. How do people who use drugs tap into maybe palliatives that were given during that time? Because, I mean, this would be okay in a society like the developed economies where, you know, drug use may not be maybe regulated, but not criminalized. But for third world countries like this, it poses a peculiar problem as to the management of the whole fund and the whole system for pandemic preparedness. Thank you.
Thanks, Needy. John?
My name is John from Australia, representing ABO. So I think when it comes to Australia, we're lucky to have a good medical system, but when it came to the pandemic, there was so much stigma and discrimination already affecting people who use drugs seeking services, and that was really just enhanced through the experience of the pandemic. And the harm reduction services and the peer-led services are already underfunded. So when it came to being able to provide help, especially over the phone or through apps or things like that, we don't have anything like that. We do have an hepatitis info line, but it's not pill-led, it's not led by people who use drug, it's not the same quality of service and support. So we're not able to provide that through the pandemic, and I think that really caused a lot of issue, especially with people that have that intersectionality with like being, for example, a migrant, someone that lives with hepatitis B or something like that, then they didn't have access to any other source of financial assistance or any type of support that maybe someone who is Australian born and raised here would have access to. And if you're someone who used drug on top of that, that really kind of just added up, and that was really difficult for people here. So I guess we do want to see a lot of change. So thank you so much for putting this together. That's so interesting. And as someone said earlier, it's quite technical, so I'm not sure if I got all of it, but we do have good connection with the Australian Department of Health. We have regular meetings with them, so we could bring things forward to discuss with them. And some of them are in connection with the civil society as well. But I guess we would need probably some bullet points or some, what do we really want to advocate? What kind of vocabulary do we want to see in the draft and things that have been put forward, and starting to advocate with the Australian Department of Health. That would be really helpful, and we would really like to support. And I guess for us as well, the Pacific region, we just want to make sure that people in the Pacific region really get the funding that they need to put some services in place and to maybe work towards that preparedness with the government as well. And for us in Australia to do the same as well and to lead the way possibly. So yeah, that's that for me.
Thanks, John. And yeah, I mean, the last few minutes anyway, we'll be like discussing and also trying to, you know, find out what INPUD can provide to support some of that country level advocacy as well. So we'll turn to that. Andy and then Judy, then I'll just see if there's any comments from the panelists. Hey, Andy. Oh, I can't see a microphone thing, so I don't know if there's issues potentially with your speaker. I'll just turn to the other hand and then maybe we can come back to you, Andy.
Hello, hello everyone, and I wish you a happy new year. My name is Juma Kwame, the director of the Tanzanian Network for People Using Drugs from Tanzania. Actually, we mentioned like Judy, I didn't edit my name over here, but it's okay. Actually, I've been listening to the whole conversation and listening to the presentation which has been given over here. And my concern was but I had two concerns. First, I had much more experience of the pandemic of the COVID-19 when it happened to Tanzania, and I saw a lot of negative, I can say negative situation or negative effects to the community of the people using drugs, even from those accessing service to the MAT clinic, and even those from those using drugs from the drug user hotspots. Most of the thing which I observed is that the issues of the safety measures or safety tools or whatever, like masks, they were very limited available to the MAT clinics, and they take time. Even the clients need to exchange those masks because you are not allowed to enter to access the methadone without wearing a mask. So it happened that people were exchanging that, which was a very dangerous situation, that people, one after drinking or taking methadone, has to come out and give another the mask again and come with it again and to access the methadone. That was the situation. But the harm reduction actually programs was a little bit slowing down, because it happens that most of the harm reduction programs or the financing came a lot from the donor country, whatever donor organizations. So it has happened that most of those donor organizations had limited time doing the work because of the situation because we didn't have a lockdown in Tanzania, but some of them, they just needed to have their self-lockdown. And it happened also that because of the congestion to some of the mat clinics, even some of the clients needed to cut off from the services. So it was a situation very hard to the Tanzanian consul. But the other thing, I was looking to the discussion of the accord, and from those key areas which have been mentioned, the human rights area, the civil society participation, and the conference and the parties. My concern is that how are we sure and what kind of mechanism will be available to ensure that our input at the community of the people who are using drug, that ensure that our input, our interests, and priorities will be taken to board of that accord. And how are we sure that we'll have a mechanism of getting the information on the right time, or what are the details of those accord and what is happening? And that was my worry that I want to put across over here. Thank you very much.
Thank you. So I don't know, Robin, Courtney, Rico. Yeah, I think one really important question that Juma asked was, yes, there are ways to keep updated on the developments, what's the website? And then, yes, it's a really important question, but yeah, difficult. How do we, make sure, is there a strategy or the best strategy to make sure our inputs are somehow taken in? Though we know, it's a difficult process.
Judy, can I just jump in? Would it be helpful if I just shared a couple of slides? Because there are a couple of ideas. Would that be helpful? And then maybe in the last 5 minutes, if there are opportunities just to hear any feedback and additional ideas, that would be great. So I'm just going to share my screen here. Can everybody see that?
Yep.
Great. So key takeaways, just quickly, we know pandemics begin and end in communities, and communities are where early detection of any kind of disease outbreak or changes in how things are developing happen at the community level. We know that communities are the first and the last responders in any public health crisis. We know this from the very beginning. Communities know how best to reach those who are the most vulnerable and the hard to reach. And communities are experts in health communications, in community data sets, all of our needs assessments, community-led monitoring, how we advance human rights and access for health for all. And each of these are really critical elements for building trust and any kind of sustainable pandemic prevention, preparedness, and response. I'm putting these here because they are important messages that you can use when you are engaging in your country level and global advocacy. So yes, time is short. We're hoping that this accord will come into place at the World Health Assembly, just a few short months away, but there are critical meetings which have been discussed already today. And there's still lots of ways to engage. Time is never out. So one thing that I would suggest is to reach out to your government counterpart by phone and email. Email is important because you want that paper trail. So reach out to your government counterpart, whether it's the Ministry of Health, well, it should be the Ministry of Health together with the different ministries of finance and so on, and request in-person meetings. I'll come back to that in a second. You should also contact your WHO country or regional office to see how you can engage and to share your perspectives and any kind of research that you might have. Make sure that they know that you want to be engaged in these discussions. Third, write. So write as much as you possibly can. Write opinion pieces, editorials, blogs, and statements. Statements that you can submit online to the global platforms. We can share those links afterwards, but also statements that you can send in to your government representatives. Fourth, meet with other civil society and community-led organizations at country level and at the global level. Please join the conversation, because there's power in numbers and there's power in voices. And it's really important so that, you know, what is happening at country level feeds up to the global level and vice versa. What's happening at the global level then is reflected into our advocacy at country level. I would also suggest, when you're reaching out to your government counterparts and to the WHO and requesting in-person meetings, go with other organizations and other people. Again, there's power in numbers, and it's always great to have additional support, but also observers who are taking part in that conversation. And then joining the global discussions. So there are a couple of groups here. The Coalition of Advocates for Global Health and Pandemic Preparedness. It's a great group. It's a loosely formed coalition. And we have regular meetings, so we can certainly share the links to those meetings so that everyone here can join. And then the Pandemic Action Network, you can go to their website and see the different updates that they have on the different INB discussions and so on. And then finally, INPUD has a lot of great resources. So these are some of the things that you can have a look at, pull out the key messages and use in your statements and your opinion pieces, right? I know that you already have your own research and your own engagement. So this can help to complement anything that you're already putting together. All right. And that is it for me for the moment. But looking forward to any kind of thoughts, comments, additional suggestions. So I'll hand it back over to Judy.
Thanks so much, Robin. Super practical and comprehensive. So Nisu, I'll just turn to you if you have a question or comment. And then if others also want to respond or have questions of Robin. Oh, no, so I just turn to Andy first, because I know we missed out before. Andy,
Now you can hear my voice?
yes, we can hear you now.
Okay, thank you. Thank you everyone. I'm just giving my attention to the lack of call to action, like Robin mentioned. First, strengthen system for health and establish national frameworks for PPPR. And second, equitable access to health, innovation, technology, and pandemic medical products and equipment, including vaccine, therapeutic, and diagnostic. Number three, maybe involve community in public health surveillance system is not yet. Number four is include social protection and related mechanism to mitigate social and economic impact on community during public health emergency. And the last is establish protective mechanism for people vulnerable to gender-based violence during public health emergency. Thank you.
Excellent. Thanks, Andy, for sharing that from Indonesia and becoming prepared with those inputs as well. So Nisu, don't know if you can unmute. But I next had Vishnu.
Yeah, thanks, Judy. I'm Vishnu from Nepal. Thank you for this opportunity. This is the questions for all, especially for the input and all the colleagues who have been working for pandemic preparedness. In Nepal, definitely we implement CRM-19, and it was somehow we could community also supported through the CRM-19 responses. On top of that, the harm reduction program in the country in Nepal is 100% supported by the donors, especially for the Global Fund. Based on that, in the preparedness, according to the community priorities, the community were trained and community were made in place in each harm reduction site, and the community were hired to respond to the pandemic. But unfortunately, after this December, I don't know, Global Fund abruptly decided they are not going to continue. We have invested a lot, we train them, and the mechanism and the system was in place because not only the COVID pandemic in Nepal do face a lot of seasonal other pandemic as well, because as for example, the last summer season, even the government declared health emergency in a dengue in some of the districts. It was highly difficult, to people, and there were a lot of people were infected by dengue. This kind of situation, we do have to, community have to continue harm reduction services. And this was the key agenda, and we don't know, still we don't have any idea, how this strong system that has been already in place, and we are not able to continue. Definitely, we are talking with the PR, we are talking with the AIDS control program. Hopefully, a few of the high-level Global Fund team, they are visiting here for different proposals, but we have already set up this one of the agenda we discussed with the Global Fund team, a high-level team as well. So this is my question. This kind of, I heard other country, they received CRM-19 support in their country, but it was never gone to the community. But in our country, we could influence to the responses through the community as well, and we did a great job, during the pandemic. We take-home dose, OST take-home dose, and door-to-door ERT services were conducted, and many of our peers, they were infected while they were doing the challenge job. Some of us, our friends, they are with us, so we had to go every day out, in difficult situation. Our neighborhood, our family they were not ready to support us, although we decided this is for the community, we need to go on. So especially for the whole, especially for the Judy, I think this is the agenda for Nepal. So how the pandemic instrument is, so that we can work smoothly. Yeah. Thank you.
Thanks, Vishnu. Yes, Aaron had been doing some incredible work, and yeah, it's a real shame that that work wasn't continue to be funded under C19 RM, and that you're having problems with the Global Fund grant now. It is frustrating. So I've got Nuruddin, and then someone under my name, and then maybe we'll just do just a bit of a summary and wrap up, and kind of like next steps as well as we look at, going forward. So Nuruddin.
Hey, thank you for your invitation. It's an honor to be with you. I'm Nuruddin Yasfi from Tangier, Morocco. I represent the INPUD. We believe in our team that the crucial problem is the change in the drug policy and the repressive approach in our countries. Certainly the pandemic is making things worse, which are themselves very difficult. It has lifted the mask on many yes.
Abba?
You hear me?
Yes, we can hear you. Yeah.
Okay. Certainly, the pandemic is making things worse, which are themselves very difficult. It has lifted the mask on many things, especially for vulnerable people. Ratification of treaty by countries and government must be a priority, of course. For those countries which have not yet established harm reduction and OTC programs, methadone. There are many countries they don't have this program in our region. We need to identify approach. Sorry for my English, but I try to communicate with you. Simultaneously strengthens health system such global health security and universal health coverage for people who use drugs. It's just a right to health, as mentioned in the many conventions that our country had enseigné. Ouais. Je crois, and I think that there's a lot of things that will be changed, especially drug policy in the countries, because the pandemic is just the face that we see things that not really in reality. Thank you. Sorry for my bad English.
No, thank you. It was very easy to understand. Thank you. Yeah, no issues. And just the last hand.
Hi, may I say something? Judy. Hi.
Hi.
Hi, this is Alok from India. I just want to put one issue, which I can see easily is, the children using drugs between age 10 to 18, and they are very less treatment or very not enough services for them, and they are injecting oral also, and they are using orally also different substances, and the problem is that according to the Indian law, at the age of 18, when they are tested for HIV, and most of them are found positive. And at the age of 10 to 11, 12, they start injecting. And at that very time, they are getting the infection. But there is no treatment services available at that very time to stop them there. And they keep on graduating at the age of 18. Finally, they go for HIV test. Then they are found HIV positive. Then, we enroll them into the treatment. I don't know what to do for that. It's not enough services, available in India. And that's what I wanted to say.
Thank you. Yeah, it's an awful situation. Definitely one that's very common as well, which is unfortunate. But just, yeah, in summarizing, definitely access and affordability, including for young people who use drugs, including harm reduction, is something that we want to see brought forward into the pandemic treaty or accord or agreement. Criminalization and discrimination, I think was mentioned by everybody, and also, of course, climate change as well and its impact. Robin, thanks for that incredible summary on ways to engage. Of course, we'll be sharing that with everybody. We see this as, a process up until, May 2024, and we'll be continuing to engage. So if you do have questions, we want to reach out with specific questions, just let us know. Would also encourage, people to join the coalition that Robin shared, and also the pandemic civil society group as well on pandemic, and we can share, you know, the links to that or the contacts for that as well if people want to join. Yeah, just a final thing, and I think it was mentioned by you, John, that an advocacy brief would be useful for people that do want to engage with their governments, and that's something we do want to work on, and we'll take, of course, the inputs, you know, from this into that as well, so that people have, you know, 1 or 2 page brief to share with their governments. Also, yeah, if there's more kind of specific ideas you want to engaging with the governments, or it's something that you feel would be a priority, you know, from your network, also do reach out, because we're looking at doing some small grants as well. So, you know, we'll just follow up with us on that, because we know we have a limited time frame until May 2024, but we do the best that we can. So thank you so much, Courtney, Rico, Robin, for joining, answering questions, for your presentations as well, and for your continual engagement in this process. And of course, thank you everybody for joining. I know it's a busy time, beginning of the year, but really appreciate it as ever.
Thank you. Good night. Good night
Thank
here
you.
in India.
Bye-bye.
Thanks,
Thank you.
everybody.
Bye.
Thanks, Judy. Thanks,
Thank
Rico.
you. Thank you. Bye-bye, Miss
Bye,
Judy.
everyone.
Bye.
Judy. Bye to everybody.
Bye.
Salama.